The Specialist Services Committee was created here in BC a number of years ago, and it consists of a group of specialists from the doctors of BC, along with government representatives, sometimes health authority representatives. And it was set up in order to create an ongoing quality improvement model for care, how specialists can work with the government in order to create pilot programs or to create fees to help improve quality of care within the confines of the budget that we have. As part of this, the Specialist Services Committee has created some fees for doctors to bill. These have been created outside of the tariff process and through this Specialist Services Committee process. So a number of those fees include physician telephone consultation. So if a family physician has a question, they can call the specialist, and there's a fee that we can bill for answering those questions. And the whole idea of setting up these telephone fees were to give quality care without having to wait and see the patient in the future. So there's fees for urgent telephone consultations. There's fees for physicians to follow up with their patients over the phone. There's some email fees that have been created. There's some conference fees that have been created. If you're spending extra time doing some discharge planning or advanced care planning, again, fees have been created through the Specialist Services Committee. And they're in their own section of the MSP fee guide, if you have questions about that. And then there's also a separate website that the Specialist Services Committee has that you can go to check. So if your section is interested in creating a special quality improvement project or some special fees, then you can apply to the Specialist Services Committee, and every few years they often will have some money and ask for applications towards that. So what happens if you see a patient after hours? In BC, we have a separate set of out-of-hours premiums that you can bill. So these are in addition to your consultation in general. So if you get called by the emergency department when you're on call to come in and see a patient in the emergency, if it's on the evening or weekend or holiday, or if it's much later in the evening after 11 p.m., then there's different fees that we can bill. The call-out charges are generally if you need to move from one site to another. So if you're at home and you get called into the hospital, then you bill one of these call-out charges. Then you come in, you see the patient, and then if you're seeing the patient for more than 30 minutes, then you can bill a surcharge. So this is a special bonus for doing that after-hours work. It does not pay for the first 30 minutes, but many evening consultations take 45 minutes to an hour by the time you see the patient and review any lab results and reassess the patient and decide whether they need to be admitted to hospital. So you can bill a surcharge. If you end up seeing another patient right after seeing your first patient, then you bill a consultation, and then you can continue billing surcharges every half an hour that you're seeing patients. So if you move from one patient to the next, then just make sure in the notes field for the second patient, when you're billing that, you put CCFPP or continuing care from previous patient. And then the system knows that you saw another patient before. This is continuing care. So you're allowed to continue to bill a surcharge every half hour, and you don't have to wait that initial 30 minutes like you did when you first came to see the patient. The surgeons also have similar after-hours fees, and generally they've set it up to be a percentage of the operation that's done after hours. Another question that often comes up is what happens when you're working with a resident, and how do you bill for procedures in those situations? So if you're supervising a resident and you're in your office and they're seeing one or two patients, and in the meantime you're seeing a couple of patients, then the philosophy is you can't bill more than you would normally bill for your hour-to-hour work. So if you're seeing one or two patients, the resident's seeing one, and then you take a break and review that patient with the resident, and then go see the patient, then you can bill for those services. But if a resident is off by themselves seeing patients, and you never do see that patient, and you're seeing patients in the meantime, then you can't double bill for the same hour of work. So we often do end up working with residents in the office or in the hospital, and you just need to make sure you set some time aside to review those consultations and visits and then see the patient. The medical services plan does not pay for work done as part of medical research or experimental medicine.